Hi, my name is Nidhi Sharma. I'm a women's health physical therapist here in New York, working at FuncPhysio Physical Therapy. I am a clinical specialist in orthopedics and women's health, and I've been treating for over 12 years. I mostly treat women and men with pelvic health problems before pregnancy, after pregnancy, throughout the lifetime. I treat pelvic pain, I treat women after menopause, all urogynecological problems and pelvic health problems through the spectrum. So today we're talking about pelvic organ prolapse during pregnancy and postpartum. We have mentioned this a couple of times. This series of presentation is meant for population, general populations, patients, women who are pregnant, who were pregnant in recent past. It's not meant for practitioners in detail. If you're a practitioner, we're happy for you to listen, but we do have more modules coming up where we will actually talk to practitioners and teach practitioners in helping these women get back to function and avoid problems. Okay, so feel free to type any questions you have. Okay, so pelvic organ prolapse. What is pelvic organ prolapse? Basically, inside the pelvis, so if this is the pelvis, there's the bone on the right side, bone on the left side. There are three organs inside the pelvis. So you look at the pelvis as a bowl, bone on the one side, bone on the other side, and there's pelvic floor at the bottom. There are three organs inside this pelvis. Bladder, where you collect your pee, rectum, where you collect your poop, and uterus, where the baby is. So basically, these three organs live inside this cavity or space called pelvic cavity. The bottom of this cavity is made by a muscle and thick tissue called pelvic floor, muscles, and fascia. And you can see in this picture, basically looks like a sling under the pelvis. And the organs are inside. The organs usually are not, so here we don't show all of the anatomy. The organs are not just sitting there, they're not just resting there. They're basically hanging or suspended from the sides of the pelvis. So I'll just clarify this here. Where's this? Yep. So from that picture to this picture, if you look at it, there are organs, right? The bladder, the rectum, the bowel. The bladder, the bowel, and the uterus. They are inside the pelvis. There are bones on both sides. And then there are thick ropes that attach these organs to the side of the bones. So you can see these ropes are called ligaments. And then this pelvic floor at the bottom. So pelvic floor forms this muscle, kind of forms like the water under the boat. The boat is the organ. Ligaments form the ropes that are hanging the boat, and then there are muscles on top of the pelvis, the back muscles, hip muscles, abdominal muscles that keep this pelvis together. So what happens during pregnancy? If you have attended the previous seminars, I talked about this. These bones become a little bit looser. They start to move, they start to expand a little. The muscles of the back and the abdomen, they both become looser. The abdominals have to stretch a lot because there's a baby growing there. The pelvic floor at the bottom stretches out. And then there's a baby inside the organ, which means the organ becomes heavier. So altogether, the organ is heavy. The pelvic floor is weak or stretched out. The muscles on the sides are stretched out. And the bones of the pelvis are moving more. So together, what happens is now the ligaments get to stretch a lot more and the organs tend to sit lower. So in normal scenario, when we look through the vaginal opening, we should see nothing. We should see an opening of the vagina, an opening of the urethra, and anal opening. With prolapse, we sometimes see a little tissue or some part of organ protruding through that opening, okay? So as all these changes happen, organ prolapse is when the organs start to descend or move down from their original position. And it's not just because the organ is heavy, it's also because the pelvis is wider, because the ligaments are stretched, because the pelvic floor is weak, all of those things together. That's why I showed you that picture. Three organs were there: bladder, rectum, and uterus. Either one of them can move down. Usually it is the bladder, because bladder is the most mobile organ inside the pelvic cavity. So similar picture from the last time. You see we're cutting from the side and we look inside. There is the bladder, uterus, rectum, and this is what the pelvis would look like without a prolapse. Bladder is up here. You see this is the opening called urethra, where you pee from. This is the vagina. This would be the anal opening where you poop from. And all these three openings have their own line and organs are in their place. This is the mild prolapse. Mild prolapse is when the bladder start to move down from its position. It's sort of drooping down, and now it's coming through or pushing into the vaginal canal. And you can see that here. And then the grade 2 would be coming out more and coming to the level of the vaginal opening. Stage 3 would be when it's coming out of the vaginal opening, and 4 would be coming out all the way. Most common prolapses in during or after pregnancy is stage 1 or 2. 3 sometimes happen, 4 almost never happens, very rare. Happens usually after surgeries or in older age for other reasons. Similar thing can happen to uterus and rectum, exact same thing, different tissue but coming through the vaginal opening. Again, we focus a lot more on bladder because bladder and rectum are the two things that prolapse the most during pregnancy. We're talking about pregnancy here. Why does it happen? So all of those things happen, so we can show why it would happen, but why does it happen in some women and not in others? Okay. So what are the risk factors? The first risk factor is genetic. We don't exactly know. Some women with some specific size or shape of their pelvis, specific size or shape of their vaginal opening, the distance between their vaginal opening to anal opening, different factors, anatomical factors can predispose some women. We don't discuss this a whole lot because these are not modifiable. We're not going to change the shape of your pelvis or shape of your vagina. So some genetic factors are there and basically just there. Second is obesity. So remember I said the organs sort of move down. Now when the organs are moving down, anything that pushes on them from the top, well, can cause them to move down more. That's one of the reasons this happens during pregnancy, because there's the weight of the baby. So body prepares you to take the weight of the baby, and we should do the exercises to take weight of the baby. But if you are obese or you have a high BMI going into pregnancy, then you have extra weight, even more weight than what baby is going to give you. And that tends to push down or create constant or repetitive pressure into the organs, which might predispose women to having prolapse. Habit of bearing down. Again, any pressure that gets you to move down, gets the organs to push down. So habit of bearing down usually is in constipation. If you are somebody who has had constipation for a long time, you know what I'm talking about. You sit at the toilet, and every time you pass some stool, you have to push a lot. So if you're creating bearing down, if you're going, if that's what you're doing, trying to get your bowel to move, you are creating that extra pressure into the pelvic floor. And we'll look at a detailed picture a little bit later. Multiple pregnancies. Parity is one cause or risk factor. So consecutive babies, second baby is a little bit more than first, third baby a little bit more than second. So if you have a mild prolapse after first, you should rehabilitate your pelvic floor and get stronger before you go into the second pregnancy, so that you prevent the chances of it getting worse. Vaginal delivery is also sometimes considered more than the cesarean delivery. Vaginal delivery in itself seems to not be such a big issue. It is really the use of forceps. I talked about this in my Instagram stories today. It's really the use of forceps that if we look at the vaginal delivery closely, we find the women who had instrument-assisted delivery, especially use of forceps, are the ones that tend to develop the prolapse a lot more. Large babies and pelvic floor muscle injury during delivery. So if you are feeling weak down there, if you're feeling loose down there, if there's a tear, if they use forceps, if you have had multiple babies, all these are causes for you to go seek care. 50 to 60% of women will develop prolapse grade 1 or 2. A huge majority of these women are not symptomatic. They don't feel anything. And that's a good thing. You're not feeling anything. Remember, I said the grade 1 is when the bladder is sort of moving down, but it's not coming through your vaginal opening. And because it's not coming through your vaginal opening, you may not feel it. And that's a good stage to take care of it. So after you have the baby, go to a physical therapist so we can look, where is your bladder? Is it in place? And if it's drooping down just a little bit, that's an excellent time to get stronger and reverse that prolapse. Grade 1 and grade 2 can be reversed and improved with the organs going back to their place. Prevention. Get constipation under control. Again, I'll talk about constipation a little bit more, but constipation means you're bearing down, constantly bearing down. Okay, so if diet is something through which you can control your constipation, I want you to do that. Healthy weight gain. More weight means more pressure. You are going to gain weight because you're pregnant. I just don't want you to gain more weight than what's appropriate for your age and your height and your weight. So make sure that you talk to your doctor if you're gaining too much weight, if there are ways you can eat healthier. Pelvic floor muscle strengthening, that was the muscle that was underneath the pelvis that can help the pelvis go up, organs go up. So strengthening of pelvic floor is one of the primary ways we try to prevent and manage pelvic organ prolapse. Proper bowel movement strategies. If you are going to bowel movement, if you're pooping by constantly bearing down, that's something that's going to create pressure. So we want you to change that, and I'm going to talk about that a little bit later. Healthy labor movements. This is not always possible for all women. If you are constantly pushing a lot throughout the labor, you're creating downward pressure. Okay, so the ideal scenario is when the stage of second stage of labor is a little bit shorter and you don't need to push down as much. Again, not something that you can always control, especially if you've had epidural. Regular exercise. Exercise is going to strengthen all the muscles we talked about and hopefully give you a better chance of not gaining too much weight. So here we are, constipation and prolapse. So we're looking at ultrasound picture. So we're looking straight up through the vagina. I put the ultrasound head on her vaginal opening and we're looking straight up into the pelvis. So the reason I'm showing you this is I want to show you in real time what happens when you bear down, when you're constipated and you're constantly bearing down to have a bowel movement. What does it do to your organs? So this big bag, black bag, is bladder. This is, so if it's kind of the same side view that we had earlier. This is the bladder. This is vagina. This is rectum. And in rectum is where the stool would be. So there would be stool and it would come down here. So the picture, what she did was I asked the patient to bear down, like she would have try to have a bowel movement. And this is what happened. So she's gonna bear down and create the pressure down, and you can see that the pressure came through here and stool would move down, right? So you are basically pushing the rectum down so the stool moves down, but look what else you push down. You push down on the bladder. So there is no way that when you push down only on one organ. You're gonna push down on all three organs. So if you push down on uterus while having a baby, you're also pushing down on bladder. If you push down on rectum while trying to poop, you're also going to push down on bladder. So any thing you do, any of those organs you push down or bear down a lot in, it's going to travel to all three organs and all three openings. So constant or chronic constipation, so everyone pushes once or twice to get started when you have a bowel movement, but you should not be pushing for 20 minutes or 30 minutes. You should not be pushing every time to get the bowel to move. So one more time, push down, and you can see how far into the vaginal opening that bladder moves down. Right. There it is. Okay, so what should you do? You should, during pregnancy, constipation is very common because we're taking the iron supplement, which really makes the stool move slower and increases the density of stool. So more water, more vegetables, all the diet changes that you can do, okay? More fiber. But more apart from that, there is a technique to bowel movement, which we all basically do wrong these days. So I'm going to talk about that technique a little bit. So the way that rectum works is, this is the rectum where your poop is, and this is the anal opening. So usually it's a little bit of a kink like this, okay? And there's a muscle that pulls on this kink, and that's how you hold your poop. So this is a pelvic floor muscle that pulls up. So when you're standing up, your rectum looks like this. There's a kink in it, and that's why you can control it, and the poop is not going to leak out. When you sit down in that 90-degree position, the first position in the picture, what happens is it comes down a little bit. So the kink is not quite strong, it's a little bit less. Okay, so you can move the stool a little bit easier now because there's less of a kink. But there still is a kink, okay? It's not straight. What will make this whole thing a lot more efficient is if you were to get into position where you were almost squatting, where your knees were close to your chest. And that basically takes this rectum from here and brings it here and pretty much straightens this tube. And now obviously if the tube is straight, your stool is soft, you should not have to push a lot. Okay, you should push once or twice, and then the stool should just move. So there are these little stools that are in the market. The most common brand is called Squatty Potty. It's a foldable stool. You put it under your toilet, in front of your toilet. You put your legs up on it. We want your hips to be above your knees. And if you're pregnant, your belly is in the way, bring your knees apart and bring your knees up. Okay. Put 2 trash cans, put something, whatever you want. Get yourself in a squatting position. And once you are in squatting position, you're going to breathe deep into your belly. So you're going to go, and then you're going to keep your belly big. Okay, so don't breathe out. Hold that breath. Keep your belly big, and then you're going to push down or bear down with an open mouth. So you go, and that should take once or twice of pushing. The reason I don't want you to push with a closed mouth is when you push with a closed mouth, you tend to close the pelvic floor. If you're closing the pelvic floor, you're basically using that muscle, right? It's going to create a kink. That's what its function was. So what I want you to do is you're going to push a little bit to get the movement started. I want you to push with an open mouth. Open mouth pushing, it makes the pelvic floor relax. If you have taken any childbirth education classes, they tell you that during labor too. Pushing with an open mouth will relax your pelvic floor, and the relaxing of pelvic floor will open these openings so that the stuff from inside can come out, whether it's pee or poop or baby, because they're all coming out from the same, from different openings in the same structure. Okay, so breathe in, hold the breath. So breathe into your belly, make your belly big, hold that breath, and then push down or grunt with an open mouth. Open mouth is the important part. Already did that. Okay, relief. So if you have pelvic organ prolapse, most often in grade 1, Sometimes in grade 2, women don't know that they have a prolapse. So if you are 6 weeks after giving birth, 4 weeks after giving birth, you don't feel any prolapse, that's a good time to go get checked out by a pelvic floor physical therapist so we can see if you have prolapse. If you are starting to feel prolapse during pregnancy or after giving birth, this is what you can do. This is usually for after giving birth, not during pregnancy, because you cannot get in these positions. So the organs are coming down to the pelvis, right? Usual symptom is you feel like there's something in your vagina, like your vaginal opening is full, like you have a tampon there, or there is a fold of tissue inside, or there's a skin tag. Sometimes women will say, I feel like there's so much discharge there. And when we look, there is no discharge, but there's some tissue there. So good first advice I'll give you is look. Okay, so if you're pregnant, you have not looked at your vaginal opening, look what it looks like. So that when the things change and you actually have a skin tag or something, you can tell that that's a skin tag and not a tissue. Typically, if there's a prolapse, it's like a little tissue here that you can push back, like it's movable. If you push it back inside, it will go right back in. So we can tell typically that if your tissue can be pushed back in, that it's not a skin tag, it's an actual prolapse of an organ. Because gravity was the problem, right? Descending through the vaginal opening. If we take away gravity, sometimes it helps the symptoms. This is not a long-term solution. This is not any solution at all. Okay, this is just so you can get some relief from these symptoms in the meantime. Get yourself lying down, put a big pillow, maybe 2 or 3 pillows under your pelvis, lift up your pelvis. So that first position. When you lift up the pelvis, the bladder, the rectum, all the organs basically fall back down with gravity. So they go away from your vaginal opening and you feel prolapse much less. Usually this position, 10 minutes, women will say that prolapse is a lot better. Again, if you get up and walk around and pick up stuff, it will come back. But it's a good way to get relief, especially in those first 2-3 weeks after giving birth, when your prolapse is not quite prolapse, it's just that the organs haven't gone back to their place. This is the other position that you can try. Both positions are for all kinds of prolapse, so you're going to try both to see which one feels better. The second one is you take 2 pillows and you basically hug and you get the back side of the pelvis up. So the front side of pelvis is up in the first picture, the back side is up in the second picture. You can try both and see which one feels better. You basically will feel that that tissue that was there is not there anymore. That extra tissue, that bulge, that fullness in your vaginal opening is gone or is less. Okay, so you should do Kegels. Okay, we already showed you how Kegels, pelvic floor was that muscle underneath all those organs. When the pelvic floor contracts, it can help lift these organs. Very often, I discussed a lot about Kegels in my couple of presentations ago when we were talking about incontinence or leaking. So if you haven't watched that one, I think you should watch that one because we go a lot more detail of pelvic floor in that. But I'm going to briefly explain here. So pelvic floor is here, and what it does is it squeezes, it closes the openings, but more than that, it lifts up the organs. It lifts up the bladder, the bowel, the rectum, the uterus. So what we want to think about when you're doing Kegels is not just squeeze the vaginal opening or squeeze or close the urethral opening. What we want to think about is lifting up. Okay, so there are a bunch of cues I discussed in the other presentation. The 3 cues that I like the most are, imagine there is a tampon inside your vagina and you're trying to pull it in. Like the tampon is loose or too small and it's falling out and you want to keep it in. So think about pulling the tampon inside the vaginal opening. Okay, you can also think about holding your gas and then holding your pee at the same time and then pulling both of those openings towards each other. So hold your gas, hold your pee, and then pull both of them towards each other or inside your body. You can also imagine that the inside of your pelvis is like an elevator. So we saw that picture earlier. It literally looks like a floor. And I want you to think about lifting that floor up. Okay. So these are the 3 Kegel cues that help the most. Doing Kegels during pregnancy can help you prevent pelvic organ prolapse and leaking. Okay, so there is some evidence for that. We definitely want you to do Kegels during your workouts, during your day, to prevent these pelvic organ prolapse and leaking problems from happening. So in this picture earlier, we said what muscles can help keep the organs in place, right? We said these are the organs. They are suspended from the side. All the orange shade here in this picture are the muscles. So the pelvic floor muscles can help because they can help lift the organs. The back muscles can help because they can help keep the pelvis more stable. Abdominal muscles, and I didn't write hip muscles, abdominal muscles and hip muscles can help because they can all keep the bones more stable. So bones will move, organs will move, pelvic floor will move. We can't keep bones from moving, bones are bones, but we can help the muscles around those bones so they're stronger and they don't let the bones move too much. That's why hip muscles, abdominal muscles, and back muscles, strengthening all 3 of these muscles can help the prolapse. Okay, so I'm going to talk about the hip muscles first, because they are the easiest to use along with the other exercises. Okay, so your buttock muscles, your inner thigh muscles, your outer thigh muscles, and your deep abdominals, not your six-pack of muscles, but your deep abdominals. So we're going to talk about engaging the deep abdominals. So we're going into the part of the presentation where these are the exercises that you do to prevent prolapse, and in the beginning 4-6 weeks after giving birth to basically help some of that prolapse if you already have it. Okay, again, this video I have shown in pretty much all the presentations. We're basically engaging the deeper part of the abdominals and pelvic floor together. Okay, so here it is. So I'm going to breathe into my belly and expand my belly. As I breathe out, I'm going to blow out from my mouth. I'm going to go. And as I blow out, I'm going to think about making the side of my trunk or the sides of my pelvis, think about bringing it together. And then at the same time, think about pulling your tampon in. This activity engages the deepest part of your core muscles or your abdominal muscles that help you engage that part and also the pelvic floor in a supportive way. Okay, so breathe into my belly, breathe out from the mouth, think about pulling the sides together, and then think about pulling the tampon in at the same time. I am not gripping my abs. I am not sucking in my stomach. I'm gently breathing out and thinking about moving those bones together. Those bones are not actually moving. My hands are just showing the direction, and then I'm thinking about pulling my tampon in. Okay. If these are too many cues, you can just breathe out and think about pulling your tampon in at the same time. That's okay. So breathing out or blowing out and pulling the tampon in usually will get you to do a good Kegel. Okay, but if you add the side of the abdominals, that might help you get even stronger contraction of your abdominals that will help your pelvic floor. But do not suck in your stomach. Do not grip your belly. Okay, using the buttock muscles can help. So similar thing, breathing in. As I breathe out, I'm going to blow out, pull the sides together, and then I'm going to lift my bottom up off the table. The big muscles of your buttock can help really stabilize that pelvic bone. And stabilizing that pelvic bone can help you keep those organs from getting pushed down all the time. Apart from the fact just going up will help you with the gravity for the organs to be pulled down. Okay. Hip muscles, the inner thigh muscles and outer thigh muscles, they both are good friends of pelvic floor muscles. Okay. So I said this in last presentation too. I don't want you to engage these muscles in place of Kegels or pelvic floor muscles. I want you to engage these muscles along with pelvic floor muscles. So make sure that you're engaging your pelvic floor muscles with all those cues or the last presentation we talked about. And along with those Kegels, or after you do Kegels, you can add these hip movements because they will help your Kegels and they will help your pelvis stay a little bit more stable. So I've taken a stretchy band around my knees. And I'm just pulling it out, and that's going to engage the outer thigh muscles, which can help. I don't know why both of them playing. Okay. And then in this one, I'm breathing in and I'm squeezing a yoga block or a ball, whatever you can have, to engage the inner thigh muscles. Okay. Whenever I pull the band, I squeeze the ball, I lift my pelvis, all the exercise I did, every time I'm thinking about breathing out and pulling my tampon in. Breathing out and pulling my tampon in. Constant thought in my brain is to bring the Kegel or pelvic floor into all of these exercises. Okay, these are a little bit higher level. This is a chair pose. So if you're pregnant and you don't want to lie down on your back, this is a good one. If you're starting to feel some prolapse, some organ coming down or leaking, take a yoga block between your knees, squeeze it. Okay, and then go ahead, get into a chair pose. And as you come up, you're going to breathe out and you're going to think about pulling your tampon in. Breathe out and tampon in. Okay, so, and obviously I'm squeezing the block the whole time. Okay, the other one, I think this one is pretty similar. Squeezing the yoga block. Breathe out, pull the tampon in, and lift up the pelvis. Okay. All of these exercises are pretty basic. They are excellent exercises to do to prevent prolapse from happening, to engage, to basically add these to your workouts if you're already doing something, and to do them in the first 4 weeks after giving birth when you're too weak and things are a little bit too loose to do anything else. These are excellent exercises to start then. PESSARY. PESSARY is a device. It's a little ring, sometimes a plug, different shapes. Basically a device that can be put inside the vaginal opening to hold the organs up in their place. Okay. It's not a long-term solution for most women. It's a short-term solution while you try to get your pelvic floor stronger. So you're not constantly creating a downward pressure while you're walking or lifting or carrying. So PESSARY is a good idea to do when you are trying to hold the pelvic organs in place for short term. Usually it's prescribed and fitted by an OBGYN. So you can talk to your doctor about it. But usually PESSARY is not a helpful solution if you're not doing something with it, if you're not training the muscles to do the job themselves, basically. So it's a good adjunct to physical therapy and exercise if you're doing both of them. So PESSARY will usually be fitted by the doctor, and you should discuss that with your doctor if you're feeling prolapse, and it can be a nice short-term adjunct to your treatment. Okay, so again, what if you feel prolapse with the exercises? This is for when you're pregnant and right after you're pregnant, but also for later after giving birth, 6 months after giving birth, 8 months after giving birth, right? So now you're fine with most things, but some things you do, you feel a prolapse, right? So let's say if you do a sit-up, you feel a prolapse. If you do squats, you feel a prolapse. If you pick up your toddler, you feel some bulge or pushing down, but you don't feel it all the time. Okay, prolapse is movable, first of all. Okay, If you lie down, the organs go back in their place. If you stand up for a long time, they tend to come down. If you push down with constipation or picking up something that you create a pressure, it will come down more. So it can vary throughout the day. It usually does. So if you're feeling prolapse with certain exercises or certain activities, you should definitely go see a physical therapist. But in the meantime, or for practitioners who are listening to this, what are the things you can try in the meantime? Breathe out as you exert. The simple way to think about it is blow before you go, because breathing out tends to engage the pelvic floor. So if you are not always thinking about Kegel, breathing out is usually an easier way to think. And you're going to think about breathing out like blowing a candle. So not, remember I said open mouth, breathing out is going to relax the pelvic floor. So this is relax. This is contract. So you're going to blow like you're blowing a candle as you exert. So let's say you have to pick up the baby and put her in the car. So when you bend over and you're about to pick her up, you're going to go and think about pulling your pelvic floor up, keep it, and then lift her up and then relax. Again, not a long-term solution, but you can do those activities, blowing and trying to engage that pelvic floor. Do not grip your abdominals. This is the picture here of the balloon. This is what your trunk looks like. When you squeeze your abdominals too much, so if you're gripping your abs, if you're sucking in your belly, if your pants are too tight, if you're putting a very tight waist trainer, all of those things create this extra pressure in your trunk, basically, and pushes down in your pelvic floor. So all that extra pressure that you created here is going to go somewhere, and that typically is down. And it makes your pelvic floor push down more. You may not feel it right away, but that constant gripping of the abs is going to keep you from engaging your pelvic floor. A lot of times women who are engaging their pelvic floor, who are gripping their abs trying to look flatter after giving birth, are basically making their pelvic floor weaker or keeping it from getting stronger by always sucking in their abs. There is nothing wrong with working out abs. There's something wrong with thinking only about abs and not about pelvic floor. You have to engage the abs and pelvic floor at the same time. Those things work together. And if you engage that deep core we talked about earlier, and then slowly progress from there, your abdominal exercises cannot go stronger than what your pelvic floor can handle. Every time you engage the abdominals, you push down in your pelvic floor, which doesn't mean that it's wrong. It just means that you have to strengthen them together. This one is stronger, this is not yet, so give it time. Make sure the pelvic floor gets stronger, then make the abs a little bit stronger. So make sure they're going together. So do not grip your abdominals, do not suck in your stomach. Do not wear very tight belly bands. Do not round your upper back. There's actually research that shows that rounding of your upper back tends to create more pressure, okay? Tends to create more pressure in the pelvic floor. And that's a long discussion, but in short, if every time, every activity you do is by rounding your back, then and you keep feeling it, then that's something to correct. Be a little bit straighter. And we've talked about posture in earlier presentations. You can go over those. You can try decreasing the range of exercise. So if it's a squat, don't go as deep, right? If it's a sit-up, don't come up as high, along with breathing out, and then you can decrease the load. I ideally don't want you to stop doing the exercise. I want you to modify it as much as possible rather than stopping it. The only time we sometimes want you to stop it is doing isolated abdominal exercises like a sit-up or a crunch tends to challenge the pelvic floor a lot more than any other exercise. Okay, so that's not to say that they're bad, but it just means that your hip muscles are not doing anything, your back muscles are not doing much. All you're doing is you're engaging that six-pack muscle from the top, and it's creating a lot of pressure that's going to push down into the pelvic floor. Ideally, what should happen is that pelvic floor contracts back and they basically balance each other out. That's the ideal situation. Now, the ideal situation is not there because you have a prolapse. So this is one of those situations that is challenging. If you're feeling prolapse and sit-ups and crunches, maybe it's better to do more comprehensive movements like squats and lunges, even planks, hands and knees, Pilates kind of workout, bar kind of workout. There are so many things you can do where you strengthen your abs, or you can do obliques and sit-up kind of motions, more inclined, not lying down all the way, that can strengthen your abs without challenging the pelvic floor as much. Okay, again, I'm not saying they're bad. I'm just saying they are very hard on pelvic floor. So make sure your pelvic floor is strong enough to take that pressure before you give it. And that's sit-up and crunches, or any motions that kind of go like that. Different exercises, usually in Pilates. Are certain exercises bad for prolapse? So again, I brought this question up on my Instagram yesterday. Is lifting bad for prolapse or sit-up bad for prolapse? I'll show you an ultrasound video here of my patients. What I did was, she had prolapse. She was feeling bulge in her vagina. I had her do a sit-up. She did a sit-up. She felt a bulge. Then I gave her cues, basically engaging the deep core that we talked about. I said, blow strongly. You go before you lift up your head, and gently pull the pelvic floor up, or pull your tampon in. And this is what happened. So this is the first time she is doing a sit-up. She is doing a sit-up, and you can see her bladder is moving down into the vaginal opening. It's pushing down. The second time, I asked her to engage the Second time, I asked her to engage her pelvic floor and blow out. And now she's doing a sit-up and the bladder didn't move. Okay, so this is an example of you can change things. It's not about what you're doing. It's about how you're doing it. This is not to say it will work for everyone. It won't. But just because lifting is giving you symptoms doesn't mean lifting is the problem. It could be how you're lifting. It could be how much you're lifting. It could also be why you're lifting, right? If you're not paying attention, if you're lifting for work 8 hours a day, that's different than you lifting to get stronger. I don't want you to stop lifting or stop doing sit-ups or stop working out thinking that it's increasing the pressure. Let's just not do anything. If you don't do anything, that might make it worse. We want to strengthen the muscles, especially the hip muscles and the back muscles and your pelvic floor muscles. And with a good variation, we also want to strengthen your abdominals. All of this strengthening is going to help your prolapse. We just have to do it smartly. So try not to follow a restriction. Don't do this ever. That usually is not helpful. Note about immediate postpartum period. Most women get freaked out after they watch this information when they come out of delivery a week out, 5 days out, and they feel a bulge or they see something. That's not prolapse. Or it is prolapse, but it's not permanent. That's just your uterus has just not shrunken back to its size just yet. So it's still pushing on the bladder. Right? So give it 4 to 6 weeks. The vaginal opening is going to shrink. All of the organs are going to shrink. Things are going to go back. So don't panic just yet. It is an excellent time to go into that position where the organs were going down, right? So if you're feeding and you're resting, spend 10, 15 minutes twice a day, 10 minutes twice a day in that position where the organs go back. And practice doing Kegels, practice engaging your deep core, practice breathing out. Manage your constipation. Definitely manage your constipation, especially right after giving birth, because it's a huge problem. Take medication if you need to. Don't put a very tight belly band. A snug one is okay, but not a very tight one. Do not strain to go to bathroom. And do not rush to sit-ups. Don't think that I'm going to go do sit-ups right away because now I can. I don't have a baby. Let me just get flat abs. Let me just start running. those things are going to increase the pressure into that pelvic floor, which hasn't returned back to its position yet. Okay, so this time use to strengthen your hips, use to do all the exercises we talked about in this presentation, which are safe for all the pelvic floor issues. In physical therapy, we get a lot more specific. Both of those ultrasounds were from my patients in the clinic. I was showing them, listen, this is what happens when you're doing a sit-up and you don't breathe. This happens when you do breathe. This happens when you're lifting and you hold your breath. This happens when you keep your toes out. So we're basically looking at the pelvic floor internally through our X-ray vision on the ultrasound, and we can change things. So it's a lot more efficient. Again, if you have a prolapse, you should go to physical therapy. If you have a grade 1, we can reverse it. If you have a grade 2, we can decrease it and often reverse it. Even grade 3, we can bring down a little bit. So make sure you do that before you decide on surgery or any other invasive measures. If you do decide on surgery, know that there is a 50% failure rate of surgery for women who do not strengthen their pelvic floor. Okay, so even if they pull the organs back and put them in their place, if you're still pushing down because of constipation, if you're still pushing down because of the abdominals, if your pelvic floor is still weak, those organs are slowly going to come down again. Okay, so even if you decide to do surgery, make sure you absolutely do physical therapy to rehabilitate and give yourself best chances. But this presentation is excellent to prevent and to use in those first few weeks after giving birth. All right, those are the references from earlier, and thank you. All right, thank you, everyone.
Thank you.
Bye.